As we age, the stem cells in our body reduces. This process is called aging. If we take stem cells and administer it back into your body, we are basically reversing this process. Therefore, it is called anti-aging. What we do using stem cell therapy is we bring your body back to how it was before. I will not specifically mention how many years, but the difference is quite significant, especially if your age is higher. An older person given stem cell therapy will feel a lot of improvement because the body will start functioning like how it was many years ago. But if a younger person takes it, you will feel the difference, you will feel better, but of course the significance or the impact may not be as great. We focus a lot on anti-aging. Basically what we want is graceful aging. Everybody ages, you cannot stop aging, but if we can age gracefully, if we can age without having to suffer from many problems, if we can age without having to see so much of sagging of skin, wrinkles on the face, if we can age without having to suffer from hormone imbalances, if we can age without having to suffer from significant hair loss, if men can age without having to suffer from erectile dysfunction, if women can age without having to suffer from hormone imbalances due to menopause, why not? And this is what stem cells can do. Stem cells can prevent and slow down the aging process significantly. But since aging is an ongoing process, therefore there may be a requirement for top-ups. So one session will of course give you a lot of benefit, but as we age, it is best to consider getting another session done, and we will take it as time passes by. So a good monitoring system is very important. You will need to see a doctor, you will need to have a proper monitoring system, you will need to do your bloods, and from there you will need to decide on how our treatment protocol will be. So anti-aging is definitely one of the bigger plus points for stem cell therapy. Stem cells therapy has proven to be very beneficial in the wellness industry. Why? Because when stem cells goes into our body, like I mentioned before, they have the tendency to repair any and all of the problems. So as we age, our engine does not function as well as how it used to when we were younger. So there may be tiny problems which may not be significant, you may not feel it, but these tiny problems can contribute to things like difficulty in sleeping, lack of energy, reduction in sexual desire or sexual drive, reduction in sexual performance as well. And then we're talking about things like mood changes, you're talking about depression, you're talking about anxiety, you're talking about becoming worried very easily. So these are changes that most people notice as we age because our body just does not do things like how it used to. Stem cells therapy, especially when you do not suffer from any chronic illnesses, will still find something to correct. So it will correct all these tiny problems in your body. So the results that we are looking at includes improvement in circulation. When your circulation improves, your energy improves, definitely. Your immune system becomes better, your body's defense system becomes better, so you don't tend to fall sick very often. Your sexual performance increases because blood flow, especially for men, blood flow towards the penis is very important, and when you take stem cell therapy, the circulation improves, therefore the erection becomes stronger, and you may even be able to perform more frequently than usual. It also has the capability to actually repair and regenerate cells of your skin. So what most people who take stem cell therapy see, part of the results is more supple, more tighter, less wrinkles, the skin becomes better looking, and there is a glow. So you can actually see these differences externally, not only internally. Let's touch a little bit about what I've seen with my patients when it comes to wellness. Now, I've treated severe cases of insomnia. Insomnia is the difficulty of sleeping using stem cell therapy because the patient suffered from hormone imbalance. Now, stem cells so far has been very good for hormone balancing, especially in women, because as we are closing towards menopause, our hormones tend to drop very significantly, and stem cells can actually help to increase or balance these hormone levels. I'm not saying you will get your menses back again, although we have had a few patients who did develop 2 to 3 sessions of their menses despite having menopause for quite some time. But what I'm saying is it balances the hormones, so it keeps it at a level where your body is able to perform well. So I've treated patients with insomnia and they have shown significant improvement, able to sleep better, less episodes of anxiety or less depression. They feel more confident with themselves. That's number one. Number two, when we are talking about male hormone balancing, so of course when the male hormones compared to female hormones, we tend to have a decline later in life. Women tend to have it earlier. However, when there is a decline, it affects our sexual performance, it affects the erection ability, it affects the sexual desire. Stem cells can actually rectify this. Most of our patients who undergo stem cell therapy almost always have very strong erections on the next day, and what we tell them is it is working on your circulation, so this is a very, very common symptom. It's a good side effect, and it's not only about maintaining an erection for a longer period, it's also the ability to have multiple erections in a day, so you're able to actually have better performance. Some of our patients who have taken stem cells also without doing a local injection, so I'm not talking about directed injection to the face, but through intravenous stem cell therapies, came in with better skin despite their age. Some of them were 60, 70 years old, but they looked radiant, they had the glow, the skin looked tighter. So these are correction of tiny problems on the inside which reflects on the outside. So this is what stem cells can do for wellness. We're talking about wellness. At the same time, what we do as a booster is, for instance, if you're coming for an aesthetic procedure, for beauty for instance, and we give you an intravenous stem cell therapy, we also do a direct injection to the face. So you have both an internal as well as an external response of stem cells, which gives you an enhanced result. This also works for things like erectile dysfunction. So when you take intravenous stem cells to correct the problems from within, we also give you an injection on the external, that means into the penis, which will help to correct the problems externally. So this could include improving the vessels or more vessels in the penis. It also improves because another thing that I didn't mention about erectile dysfunction is the cavernous tissue. Cavernous tissue is a soft tissue which is very important for erection, and when we inject stem cells into the cavernous tissue, we enhance their performance as well. So stem cells for wellness gives amazing results when administered both intravenously as well as on an external approach. Some of the cases that I have treated include severe cases of anxiety. So one of my patients came in with very severe anxiety, multiple problems. Of course, there was hormone imbalance. She had very high levels of stress, and stem cell therapy when it exerts this balancing in the body, this metabolic balancing, it actually helped this patient to improve a lot. So of course, there was hormone balancing, so her hormones were corrected very significantly. At the same time, her dependence on anti-anxiety medication dropped. So instead of taking, for instance, 10 variety of tablets in a day, she ended up only taking about 3. So this was a very significant change for the patient with anxiety.